Thanks everyone for joining this webinar. My name is Marco van Elst.
My name is Peter Krol.
And we will both first introduce our own companies and products before we will present to you our combined product. I'm part of ICT Group. ICT Group is mostly known for working in industrial automation. We have 1,500 employees and we have offices in 5 countries. We are active in several industries, amongst of that in automotive, healthcare of course, because that's what we're talking about today, but also in infrastructure, smarter cities, and a few other industries. Today I will tell you a little bit more about ICT Healthcare Technology Solutions, ICT Healthcare. We are active in radiotherapy, active in medical software development, and in obstetrics, and that's what we will focus on today. Within obstetrics, we have several products and services that mostly focus on monitoring the patient, even during pregnancy or during labor, but it's focused on monitoring the patient and the patient's well-being. Today we will tell about something about Sense4Baby. And Sense4Baby is a product to monitor a pregnant patient remotely. It's the sensors can monitor the heartbeat of the baby, the heartbeat of the mother, blood pressure, contractions, and it can all be done remotely. We do home monitoring for pregnant patients for more than 10 years, of which the last 6 years with this product. And I want to introduce the product to you by showing a small movie.
Every pregnancy is unique. Some have small complications, like when the mother has diabetes or if there's a problem with growth or movement. If there's a concern, the mother has to go all the way to the medical center, or a specialist examines and monitors her. This is stressful for the mother and the specialist who has a busy schedule. So wouldn't it be more convenient if pregnant women could have the technology and expertise of the medical center in the comfort of their home? We offer a service to monitor pregnant women from a distance. It's already in use in academic and general hospitals and meets the highest standards. Now the mother or her local caregiver can measure the condition of mother and child. The encrypted data goes to our portal, on which specialists can see if everything's fine or if more care is needed. If needed, monitoring continues on the road, so that upon arrival, it's clear if there's need for action right away. Now the mother has the same expertise in the comfort of her home, and the specialist has more time for each patient.
Hello, thanks for joining everyone. I will talk more about Medify. And with Medify, actually, we're optimizing healthcare processes through digital communication. Currently, we are working in 7 countries, in more than 40 hospitals, in 150 locations. And we have several offices in Europe, in Bucharest, Amsterdam, and Barcelona. We offer a software as a service solution within healthcare for different purposes. It can be for education, for research, and today we're going to talk about digital intake. When hospitals are using this solution, it consists of patient education, pre-screening for patients, medication verification of patients, also shared decision making about the treatments, so all the information they got. Patients give informed consent regarding all the information they got, and they also tell afterwards their experience about the whole procedure inside the hospital, which are named as PREMs. If a hospital uses, or if you're using actually our digital communication software, which is about informing patients and gathering data, you want to control the entire process. So that's why we make together and design together with the hospital's process flows, and all those process flows can be controlled via dashboards, and also, for example, the risk categorization and scoring which comes out of the questionnaires. And all the applications can be built in a content management system, where you can pick a lot of content out of the library, and we already use for entire hospitals. So we have a hospital-wide library which consists of care parts and information for all procedures within a hospital. And at least I want to show you a video about Medify.
Medify facilitates digital communication between patient and healthcare provider. Before each consultation, the hospital sends a digital information module to the patient regarding their treatment. Through a unique and secure link, the patient enters the information module. Step by step, patients experience their own journey and are familiarized with the care path. 3D animations clarify the actual procedure. The patient completes the module by filling in a questionnaire and gives informed consent for the procedure. Questionnaire answers are automatically categorized based on risk factors and integrated with the EMR of the hospital. Based on the outcome, the patient is directly scheduled for the procedure or a short consultation. Patients are able to provide feedback after the procedure, and through dashboards, the hospital can review feedback and improve internal processes. Patients can go through the module at their own pace, at home, with family, a partner, or by themselves. Patients who are not familiar with computers or the internet and have limited family or friends are guided through the module inside the hospital. This ensures that each patient is always properly informed and doctors can directly discuss all important matters. An efficient process and more attention for the patient. Medify, clarifying healthcare.
When our solution is implemented, or it's what we have seen over the last 10 years, the results of our solution is that it improves patient satisfaction. So it goes up to 96%. It also saves a lot of money, or actually time and money for hospitals. What we see is that we get to higher quality consultations, because if you send information up front and do pre-screening up front, you can have much more attention to patients during a consultation, so it's much more patient focused. And what you can see is that everybody in the hospital works via a standard process. That's why JCI likes us very much, but it's also a very good service for the patient, because they know exactly what they can get from the hospital. So this was the introduction for Medify.
Yeah, we found each other actually during a trade mission to Germany.
In Germany, yes, right.
Yeah, via Task Force Healthcare, and we were both individually pitching and promoting our products. But we soon found out that there's a lot of common ground to work on.
Yes, I think it was 2 years ago, and I think we're both, we both want that a patient, that we can use our digital solutions to help patients at home, that there's no need that they come to the hospital. And I think we're both working with dashboards, so there's one channel used in the hospital, and as we both know, it's very important that a hospital that you serve or deliver them one channel where they can have everything at once. Yeah.
I think that's exactly where we strengthen each other. I mean, we're very deep into the pregnancy monitoring at home, but your solution is more about the processes and informing the patient.
Yes, that's correct. So we can perfectly inform patients about pregnancy, about labor, everything. So we have, let's say, a solution for the entire gynecology department. But it's very important that we can serve every patient. So also the patients with diabetes, which are pregnant, which needed to be or can be monitored actually at home with Sense4Baby. Well, that is amazing, and we can see that that patient has diabetes, so we can do an e-consultation and send out an information module regarding Sense4Baby. And then also, where I'm very keen of is that actually there's data integration. So that means that you can monitor the heartbeat, etc., from distance, from out our integrated dashboards, which the hospitals like very much.
Yeah, and I think that's exactly where we find the common grounds, because both of us have similar dashboards. Of course, we focus in depth on that specific patient path, but together we make a very strong solution for every hospital. And I think that's where we find the most common grounds. So maybe it's good to go to the next slide.
Yeah.
Because then we can say something about what we think is in it for the hospitals. I think that the thing that the hospitals win most here is that the patient stays at home. If we look at the cost and the time that the hospital has if the patient is in the hospital, and specifically during this last period, we both seen an incline in the usage in home for our solutions.
Yes, actually we face the same. So with COVID, there's more need for our solutions. So there's more acceptance in hospitals as well. But what I think it's maybe always most important is that you create clarity for the patients. They know what come. They feel they're comfortable. They're at home. They can walk through all the information, do the monitoring. And that's a very important value. And what you say, you are right. It really saves time for the hospitals. But on the other hand, it increases quality as well because we're using those standard processes.
Yeah, I agree that the quality of the care takes a huge rise. And the patient feels really empowered by being able to do something herself instead of being in the hospital waiting for a doctor to stop by once a day or twice a day.
Yeah, so I think we found each other and we want to give you a demo about our solution. And I think afterwards there's time for questions as well. So please, let's go to the demo. So here we are going to introduce the demo for our integrated pregnancy solution. So the hospital or the gynecology department, they get access to a dashboard. And from that dashboard, they can send out invitations to a patient. So for example, when a woman is pregnant, you select the care path pregnancy and you send out a care path a pregnancy informational module to the patient. So the pregnant woman, she receives an email with a link. There's a privacy statement, of course, very important when we're talking about privacy and security of data, which they have to accept. And if they accept, they can enter the informational module. This is, for example, for the hospital in Amsterdam. And then they get all the information in a stepwise way, in the most visual way, with 3D information, 3D visualizations about the pregnancy. And when they have seen all the information, in the end, there's a questionnaire, a pre-screening questionnaire, where everything is asked about the medical condition of the patient. So, as you can see, there's also a room or space to fill out all the medication someone uses, but of course you want to know as well if they've got diabetes or other things which are important for pregnancy. And then in the end, when they have walked through the entire questionnaire, they push on the send button, and in the hospital, in the dashboard, on the specific patient card, they can see the outcome of the questionnaires. And together with the hospital and of course the knowledge of ICT Healthcare, we defined the risk categorization on each questionnaire. So for example, this patient, as you can see, comes out also red. So that means this patient needs home monitoring. For example, it can be that this patient has diabetes, but at least it's a risk patient. So we want to offer her, or the hospital wants to offer her home monitoring. Then they can, via the dashboard, actually via the Medify software as solution, they can immediately schedule an e-consultation and discuss with the patient if they want to do the home monitoring. Well, and what we did is, together with ICT Healthcare, of course, we created an entire module about using the Sense for Baby, how it works, the warnings, etc. So the first time we did send out a pregnancy module, but right now, because this is a risk patient, we send out a Sense for Baby informational module to the patient.
At the moment that the patient is indicated for home monitoring with Sense for Baby, the patient will receive, of course, the module, but also a device will send out. The device will be sent in a case like this, and the patient will receive the device via the mail at home, so she can start monitoring at home. And then through the modules, which I will show in a second, basically she can see all the information that she needs to start working with the monitor. So the patient receives the module, and within the module, each step of the process is being explained. So she's being told in the module if the suitcase is fully, completely delivered to her house, so she can check that herself. But she's also told step by step how to use the product. And to do that, we made instruction movies that are also shown within the Medify application. So for example, if she needs to connect the devices, it will show in a short movie how she needs to perform those steps. And you will also see that in the demonstration.
Place one of your fingers in the pulse oximeter, preferably one that you don't use to control the tablet. Click on the button to activate the pulse oximeter. Now take the tablet and click on the image of the pulse oximeter with the status disconnected. A list of available devices will pop up. Click on the pulse oximeter to connect it.
So this is one of the examples that the patient will get. And when she is done with all the steps, she can start the actual monitoring. When she does the monitoring, she needs to monitor for 30 to 40 minutes, depending on what was agreed with the caregiver. And when she's finished, she's sending the results back to the hospital, and actually within the integration it's being sent back into the Medify application. The doctor will receive all the information and also the information that she needs to fill in from another questionnaire if the doctor wants her to fill that out. So here she will fill out the questionnaire after the CTG, and when she's completely done with all the questions, the information is being sent back to the hospital, to the dashboard, where the doctor can see the information. So the doctor can see the actual CTG, you can see all the information about the patient and the questionnaire, fully integrated within our both services. So here you see the strength of the combined product. So this short demonstration shows you the combined quality of our products. You can see that both our products are already in hospital use for many years, and combined we deliver a very solid product. That brings us automatically to the conclusion, where you can see the strength of our combined products.
Yes, you can really create and monitor the entire pregnancy care path. And that's because we share and give information to the patients, but we gather also information about those pregnant women for the hospitals, and they can do the risk assessment, and then
the communication to the patient at home, where the patient feels very secure and empowered that she can do something herself again.
Yeah, I think that's really important, and what is important as well is that it really saves time, and so it lowers cost, and the quality will be better. So that's, I think, a win-win.
I fully agree. I think that's a nice closure of this presentation. If you want to have this solution also working in your hospital, or you want to have more information, please contact us through our information details that you can see here. And yeah, if there are any questions, please shoot.
Bring it on.